Explaining your contribution. In this section, we help you to explain your contribution by creating a model of your work. We suggest creating a logic model to help explain your impact. It could look something like this. A logic model is simply an explanation of your work on one page. Helpful because you can then use this to explain your contribution to others and also use it as a roadmap for measurement. We have developed an overall model which you can use to prompt ideas about how you are contributing to longer-term outcomes to prevent or mitigate the effects of health inequalities. I'll describe each section in turn. Firstly, reflect on the barriers you address and the groups you work with. These will be closely interrelated. Barriers. There are lots of factors which contribute to health inequalities. It is helpful to reflect on what you are specifically tackling. For example, your service users may be living in poverty, experiencing discrimination, and feel unsure about where to go for support. Be clear about which of these issues you are tackling. You may not be tackling all of these. Perhaps a partner organization or agency is doing some of this work too. Which part is unique to you? Groups you work with. Who you reach should describe the groups of people you work with who are at risk of experiencing health inequalities. People most at risk tend to be those experiencing multiple social and economic disadvantages, stigma, and discrimination. Setting out who you are reaching through your work is a vital step towards demonstrating impact on health inequalities. Who is affected by health inequalities? Who is in your target group? Knowing who your target groups are is helpful when we move on to measuring your impact. What role do you play? What are we here for? This may have evolved since COVID. What activities are you doing to reach them? We have grouped these into things like one-to-one support, group work, advocacy, training practitioners, and outreach work. You can make it more detailed if you want to. Next, we suggest setting out your outcomes. We have broken these down into short, medium, and long-term or strategic outcomes. Short-term outcomes. Outcomes simply describe what difference you make and to who. Short-term outcomes will be a logical result of your activity. Outcomes should always tell you what is changing, who for, and what the direction of change is. We have provided some suggested outcomes in the overall model. You will notice these are mostly soft outcomes, which means there is no obvious number to measure to see that they are happening. That is quite common. Choose no more than 5 short-term outcomes. You might want to use different language. For example, you might want to make people more specific to reflect the people you work with, such as young people leaving care in Falkirk or people at risk of homelessness in Glasgow. You'll notice that the outcomes in the model we are going to look at are all worded with positive language. Rather than being about preventing crisis or falls, it is much easier to evaluate something positive you have helped happen rather than something negative you have prevented for someone. Medium-term outcomes. Then see if you can select 2 to 3 medium-term outcomes. These outcomes should describe what usually happens to people you work with over time. Think about examples of what typically happens for the people you support over time. Medium-term outcomes are a helpful link between short-term outcomes, which we will probably evaluate more regularly, and longer-term change. Long-term outcomes. Then we suggest selecting just one strategic outcome. There should be a logical link between your medium-term outcomes and the strategic outcome. In the overall model, we have suggested choosing one of the public health priorities. but you may want to also consider local strategic priorities. The purpose of this is to show how your work contributes to longer-term outcomes around reducing health inequalities for people in Scotland. It might help to think about who you want to explain your work to. Here is an example from a parenting project. Their target group are parents experiencing multiple disadvantages in Edinburgh. The short-term outcomes are a direct result of their activity to reach parents, support them, and bring them together. Over time, by helping parents feel more confident, valued, and connected, they will have stronger relationships with others and an improved parenting capacity. As you can see, they then show how this clearly links to the public health priority is Scotland, where we flourish in our early years. Have a read through the resource Model for Demonstrating Impact on Health Inequalities. Take 5 to 10 minutes to read over it and see if you can find your work reflected in the model. If you have access to a printer, we suggest printing it off as an A3 file and using a highlighter to find your work. Can you map your groups, roles you play, activities and outcomes? It may be helpful to try and not highlight all the outcomes, but only the ones you usually make happen for people. Even if you are taking a personal outcomes approach, you can still use a model like this because you are looking for the themes. What is the typical change for service users or participants? The second exercise involves using the resource Logic Model Template to create your own model. Before you get started, consider whether your model is for a project, service, or for the whole organization. Feel free to go back to the resource Model for Demonstrating Impact on Health Inequalities for prompts and ideas. Remember, you don't need to copy the statements such as roles, activities, or outcomes word for word. These are designed to be used for inspiration. Remember to use different language that specifically reflects the people you work with, and remember to choose a maximum of 5 short-term outcomes. A simple logic model is going to be easier for others to understand. You may want to involve your team in this exercise, as the discussions can be quite helpful. That brings us to the end of explaining your contribution.